Yeah, it's all in your head, man. Don't you know that? So thank you for having me here, Harold, Jesse, and all the Florida SIP group. I've always enjoyed coming to your meeting, and I'll hopefully continue to come to your meeting, whether you invite me or not, because it's always a nice resort. So this morning we had some robust discussions about new frontiers in spinal cord stimulation and how we can take the field one step forward and really call it innovation, because now we are finding more about the mechanism of action and where actually we are stimulating. So I'm going to present to you the results of the first human study for a differential target multiplexed spinal cord stimulation system that was designed for patients suffering from chronic intractable back pain with or without leg pain. Now, a little bit of a disclaimer here. So these are my disclaimers pertinent to this talk. I don't do much of a consulting. Nobody wants to pay me. Nagy, I don't know, somehow has been more successful than me. But those are my disclaimers. Now, for decades, as my distinguished partner was mentioning this morning, we have been stimulating dorsal columns, putting the two leads in the dorsal epidural space, and all the stimulation was targeted towards neurons, blocking one neuron, blocking that, just like rubbing the boo-boo. And it was all based on gate control theory. And if you look at that little picture, you see those two red dots are your two leads. And look at how far, you're talking about somehow miraculously those leads made it to the neurons and had some kind of effect on the neurons, on the wide dynamic range neurons, but they bypassed all the other neuronal tissue, i.e. glial cells, on their way to the neurons. So this was a challenging concept for us for many years, and I can tell you this. For about 15 years, Ricardo ran the basic science research in our practice, and the main focus of that research was always the role of glial cells in chronic pain and how they could be modulated to modulate chronic pain and give patients better relief. So why glial cells? Well, when you're stimulating in the dorsal column, the stimulation is going to affect all the cells that are under the stimulation. And what is the majority of the cells under the stimulation? As you can see in these pictures, the majority of them are glial cells. As a matter of fact, this study that we did with our partners in Spain is anatomical study. We looked at the ratio of glial cells to neurons in the areas that we usually place the spinal cord stimulator, between T8 and T11. And this was just accepted for publication in the Journal of Anatomy. And the ratio is 12:1, kind of similar to the cortex. So the reality is that spinal cord stimulation does reach glial cells in addition to neurons, obviously. And the population of glial cells is a lot more, 12:1, the ratio to the neurons. So this is a reality and an objective reality that could not be disregarded. And hence, the basic science was conducted, and that was about 12 to 15 years of hard work that you saw the results of it that Ricardo presented today that basically prove that yes, glial cells are integral to chronic pain process, development, maintaining, modulation of it, and they interact very closely with neurons. Hence, we call it neuroglial interaction. And ironically, there is basic science proof that there is evidence that you can electrically modulate the glial cells. So those are the things that Ricardo presented today. Now, translating all this into clinical science was a challenge, and it was a question that we wanted to answer. So here you're facing a study, a clinical study done in humans that was based on years of basic science research that was conducted in cell cultures, small animal, and large animal. And that was the background for doing this acute feasibility study that I'm going to share with you the results. So so the question, the million-dollar question is that if spinal cord stimulation signals can reach the glial cells, and glial cells are more abundant than neurons, well, should we be targeting the glial cells? Should we be a little bit more specific and move away from this 55-year-old theory? So that's the question. So the concept is called differential target multiplex spinal cord stimulation. Why do we call it? We call it differential target because different pulse signals, they intend to affect or stimulate different cell types. So we call it differential target. Why do we call it multiplex? Because multiple pulse signals are combined within the same stimulation signal to affect different cell types. Now, those are some of the parameters for the pulse signals. They range between 20 and 1200 hertz, and the max pulse width is 1 millisecond. And multiple programs are applied according to an algorithm. Now, as you can see in that little ball that's dissected, our study was based on the fact that, again, I emphasize that beyond neurons, glial cells could be modulated, and this could be helpful. And you can apply different signals designed to modulate different cell types at neuroglial interaction. Okay, so as I mentioned, this is all based, it comes from basic science. And it's not some arbitrary numbers and algorithms, all based on basic science. And Ricardo earlier mentioned all the genetic studies that back this concept. So this is the first study designed to test this concept of our new study that is differential target multiplex spinal cord stimulation. The patients were patients with intractable chronic pain, low back pain, with or without leg pain. All the patients, 100% of the patients, had back pain. And 2 of the patients actually had equal, but majority of them had back pain, dominant pain. So this was a multi-center study, 7 centers throughout the country. It was a prospective observational study, and the comparator was a conventional spinal cord stimulation. Every patient for obvious reasons. Initially, had a trial of 3 to 5 days of conventional stimulation. There was a washout period, and then they were converted to DTM, spinal cord stimulation, differential target multiplex stimulation. The device that was used for the conventional spinal cord stimulation was Restore Ultra system. And for the DTM, it was an investigational external design to deliver the specific therapy, the DTM SCS. Who did the programming for conventional